And you've never had anything done before?
No, I had like 5 or 6 microdermabrasion treatments.
Okay.
And she would do it probably, I think it was like every couple of weeks or something.
Okay. And then the vessels through here. This little nodule, is that a mole? Or do you always have that?
It's a mole.
Okay. Do you still have problems with acne breakouts?
Yeah, it's not all the time. It just comes occasionally. It's usually only a few.
Okay.
There's sometimes little and sometimes I get one here a lot, the same place.
Okay. And the same place over and over again?
And I don't have a menstrual cycle anymore, so I guess it still like comes in a cycle then.
This little place right there?
Yeah.
Does it ever go away? That little place?
It goes away
completely?
I can't remember, I think. And then it comes back.
How long has it been there?
Since the summer.
Okay. We may need to get that checked by a dermatologist before we start. Because that might be something that we need to look at as far as medically. Okay. Alright, which might just delay our process by just a smidge. But it'll be okay.
It's so hard to get one of those appointments.
We can get you one pretty quick. We'll put in a referral and help expedite the process. Okay? So just looking at your skin, we are going to kind of start top down and get some layers off, okay? So we're going to be really working on exfoliation. We'll start with chemical peels. So we're going to start with a full face chemical peel, level 3. What are we using, Crystal?
TCA.
TCA, what percentage?
15%.
15% TCA chemical peel. So like Crystal said, you'll be peeling probably day 3 through 6. Okay, and then you should really see like sheets coming, okay? And we'll put as many layers as you can tolerate comfortably until we achieve the desired look that we want with the peel, okay? After that, what we want to do is we're going to come back in and we're going to do a manual exfoliation with microdermabrasion, okay? And all the while you'll be on some medication that will help to help your skin turn over faster and aid in collagen stimulation and those kinds of things. So we're going to come right in. Let me give you a mirror to look at. Hold on to that. Right in the deepest of your acne scars. And we're going to do what we call a TCA cross. Cross stands for chemical reconstruction of skin scars, okay? And what that does is we take a tool and we apply a very high concentrated percent of TCA. In this case, we're using 85%. So put 15% on your whole face, we're going to put 85% at the bottom of the picks of the little ice. We call these ice pick scars, okay? And what that's going to do is it's going to burn through the entire track of skin, okay? You're going to see a scab form. 3 to 5 days you'll have a scab, a little raised scab. The scab will fall off and you'll be left with a red dot, okay? And that red dot will be flat and flush with the skin, but then you should be able to cover that up with makeup, but that'll persist for 2 to 3 weeks, okay? And then you'll have nice, smooth skin underneath it. Does that make sense? And then what we'll probably do after that is kind of work on the coloring of the skin, okay? So we're going to come in with a laser device and we're going to try to take out some of this redness, okay? And we may see some improvement in the pigment, the hyperpigmentation and sun damage. We may even see some improvement in redness with the chemical peel, but really the best way to get rid of redness is with photo rejuvenation or green light IPL, okay? So we'll be doing that over especially the chin and over the bridge of the nose area, okay? Along the way, in the interim, we'll be doing some skin tightening procedures on your neck, okay? Skin tightening procedure on the neck is not painful. There's just a touch of discomfort associated with it, but there's absolutely no downtime. You should get right back to your regular activities. You don't have any redness or swelling. And we do those treatments once a week, okay? So we get some synergistic tightening of the neck. We'll probably combine that with maybe a couple of resurfacing treatments of the neck as well, okay? Once we've completed all the groundwork as far as getting your skin to look the way that we want it to look, then we're going to really work on creating the volume that makes you look younger. So there's two parts to the skin looking good, to the face looking good. One, it's the quality, tone, and texture of your skin, and the second is the amount of volume and sagging that you have. Okay, so we'll start at the top. Again, if you want to look in the mirror, can you see her when she does that? We're going to do some Botox across here. Okay, you've got a great shape to your eyebrows. You may see that you actually get a little bit more lift to the eyebrow, but you're going to get this smoothing effect where this wrinkle and this wrinkle should kind of smooth out like that. Okay, and then smile real big for me. Your crow's feet look nice. You don't have a lot of static lines. Lines meaning lines that are in your face when your face is at rest or out your face. So we probably won't need to work in this area. I think it looks a lot more natural if we cannot treat the crow's feet with Botox. And I only do that if it really looks bad when you're smiling big, or if we have lines that are in your face when it's at rest, okay? So we probably won't treat that area at all. And we'll go in through, see this groove that's starting to form along the edge of the cheek? We're going to go right in this groove, we call it a malar groove, and we're going to come in and we're going to inject some fillers into the cheek area, which is going to help to lift this cheek up a little bit, okay, and create a nice contour for the cheekbone and replace that apple and apex of the cheek, okay? We're going to gently touch the fold, the nasolabial fold. You see that line where there's kind of a disconnect when I lay that down? We're going to gently fill that in, just soften it up a bit. I don't like to completely obliterate the nasolabial fold. I think it looks a little bit strange when someone who's over 30 doesn't have any nasolabial fold. So just to soften that a little bit, okay? We want to keep everything looking super duper natural. We're going to probably put a little bit of filler in the chin area to create a contour. So this cheek that's kind of fallen down, we're going to lift that cheek up a little, which will help, and so will the skin tightening procedures. But we're going to do a little disguisery. We're going to come in here and we're going to add some filler here, okay? And that's going to give the illusion that you have this nice straight jawline, which makes you appear younger. It's also going to take away this shadow here, which is going to help the neck that has a little bit of sagging to kind of fade away into the background so that the jaw projects and looks nice and smooth. Does that make sense? So a little bit of filling in this area and along here. And then we're going to try to knock out the movement of this muscle that lies right under here that takes the lip of the corner of the lip and pulls it down. Okay? That's the depressor angularis ori, and it's like a marionette string, so that's why you hear them call this marionette line, okay? So if we take those lines and we cut them with scissors, what it does is it allows the corner of the mouth to turn up just slightly like that and puts it back in a neutral place instead of being downturned like that. We can accentuate that with a little bit of fillers. We can bolster up the strut work along the side of the mouth and give you a little bit of structure to help fold up the mouth. We'll do a gentle lip augmentation, nothing drastic, just enough to give you a little bit of lip, but nothing major, nothing that's gonna change the way that you look, just to kind of even out the symmetry and give you a little bit more border back to the lips like you probably had, 20 years ago. And last but not least, we'll do laser teeth whitening. Okay, so we'll get those teeth nice and pearly white and shiny. Okay, questions for me?
Now, what were you thinking about for this?
I wanted to refer you to a dermatologist. If you have a sore on your face that tends to be recurrent, like you get it, and it scabs over, and then the scab kind of peels away, and then it kind of gets back, and it scabs over, that can be a basal cell or a squamous cell carcinoma. We really just need to have that checked by a dermatologist and make sure that that's nothing that needs to be addressed before we proceed. So I think that's super duper important, and hopefully we can get you in as soon as possible to do that.
Okay. Sounds good.